My name is Samuel Brazell. I am an RN3 and I've been at UAMS for 4 years in August. I currently work on E4, which is the medical neuro ICU. I've always wanted to be a nurse, and so my mom was a nurse, and so I went to school and directly I was a nursing major at UCA, and so after clinicals I applied here. This is the only place I applied. UAMS, it seems like on the cutting edge of a lot of things as far as patient care and different procedures. And so I wanted to be a part of a community that I thought was making a difference in our time. So I chose UAMS. My mom has a very good work ethic, and so she worked a lot, and she would come home and she would talk about, how she made a difference in the patients' lives, not just about what she did, but she worked at a nursing home, and so the outcomes of a lot of those patients aren't great because of the nature of, why they're there. And so the stories that she would tell about how she made a difference in their day, whether it was remembering their favorite things or, showing up when even their family members didn't show up, showing that compassion and that care for someone who wasn't even her family member. That is what really inspired me. What keeps me motivated is my interaction with patients and family members, knowing that I am giving my best and doing my best to help with the care. When days are bad, being able to be that calm voice that helps redirect them and helps to not falsely reassure them, but to allow them to help them to understand that we're doing the best that we can, that we are actively participating in the care of their relative for the best outcome. For them to appreciate you at the end of the day because they see how hard you're working, they see you actually trying to make a difference, that for me is the best part.
I'm Elizabeth Sullivan. I am the E4 Clinical Services Manager. I've been here since 2008. I think the biggest difference we can make is to make everybody feel safe. I think as long as you are showing compassion, just letting them know that I'm here with you, holding their hand, just giving them that extra 5 minutes of your time, that goes a long way.
Me in particular, I like to involve the families because that gives them a better perspective of what is actually going on. Sometimes they have unrealistic goals, and them being a part of the care helps them to develop more realistic goals for their family member. You hear about patients being able to recall that their loved one was there. And so I think it's an encouragement to them. It helps them as a whole, as far as holistic care, to get better.